Hello everyone. I hope I'm live right now. Can you all please confirm if you can hear me, if you can see the video? Okay, okay, right. Good evening everyone. So I hope you all are back home after a very tiring day. Right. Our NEET MDS 2023 results have been declared yesterday. We had decided to start with the memory-based recall from today, but NBE, giving us a very pleasant surprise yesterday, released the results way beforehand, right? But still, we thought we'll continue with the memory-based recall sessions, because not only for those who have attempted the NEET MDS exam this year, this recall video is for all those who will be attending the exam next year, for all the aspirants, because you get an idea about the pattern of exam that usually comes for you all. Okay, so you get an approximate about how the paper normally is if you have not attempted any NEET MDS exams previously. So one more thing that we all know is we do not get the question paper, neither do we get an answer key. So whatever recall we have framed is from a memory base. Okay, we have collected the questions through our students. Okay, whatever they could memorize from the exams that they've given, this is a memory based recall that we'll be doing. Right. So like we had already discussed in our analysis video, paper analysis video, according to the poll, we know the paper was moderately fine, right? It was not on the difficult side, and it was not on the easier side as well, correct? Now today in this recall video, let's start with the positive note, or let's start like simple. So today's video will discuss only the simple ones, direct picks, so that it boosts a little of your confidence. Okay, right. One more thing about the results yesterday. I know some of you are very disappointed with the results. There might be some of you who are extremely happy with the results. A very hearty congratulations to all of you who have succeeded in the exam. But for the others who did not get the ranks that you all expected, don't worry. Okay, these are just results. Okay, this is not life. Okay, so don't take too much stress on it. Relax for a bit and think about what next. Okay, don't just quit your preparation midway like this. There is INI-CET coming up in May. Take up INI-CET, prepare for 2 more months, just a 2 more months extension, right? Prepare for it as well. Okay, right. INI-CET is coming. If you do not want to attempt INI-CET, don't lose hope. Do prepare for NEET MDS 2024 as well. Okay, but one thing I'd like to request you all, do not sideline your preparation. Don't keep it as plan B. Okay, always prioritize your MDS preparation. Keep it as your first priority, right? Fine. Moving ahead. So the first question, or the one of the basic question that we'll discuss today, the first thing is the drug of choice for absence seizures. So what is it that you all had marked in the answer paper? So if you are fresh aspirants who are attending the session, you all can comment the answer. Whatever you feel is the answer, you all can comment the same. Okay, so basically about absence seizure, we all know absence seizure, also called as petit mal epilepsy. We all know there is brief sudden episodes of attention lapses in absence seizures, right? So usually one more identifying feature that we'll need to know in absence seizure is that more than adults, it is frequently seen in children. Okay, so all those are some features of absence seizures. Now the treatment for absence seizures, like other seizures, are anticonvulsant drugs or anti-seizure drugs. But the drug of choice, or the first line of treatment, anybody, is valproate. Okay, valproic acid or valproate. It's a first line broad spectrum anticonvulsant drug. Okay, next question. So there was this question. So like we already discussed in our analysis video, there were too many case-based questions and long questions, correct? So it was difficult for the students to recall those questions, okay? And even it was difficult for the students to have a proper time management for the same, correct? So this question, okay, this was a long question, lengthy question, but this actually there were many long questions. Those were very simple, those were not on the difficult side, okay? So if you get the keywords right, you will be able to answer those long questions. You should not waste time reading the entire questions. Just try to find the keywords in those long questions. That's a knack to crack those questions, right? So here are some keywords of a long questions that will get you to the conclusion. So there was this question on an 8-year-old child who had brownish discoloration of teeth and also gave a history of trauma. When a hereditary history was taken, there was no hereditary history, right? This question was something like this. What could be the answer for this? What could it be? So the answer for this question is Turner's hypoplasia. So Turner's hypoplasia, we all know Turner's hypoplasia, also called as localized enamel hypoplasia. It is a type of hypoplasia which involves a single tooth, unlike the other types of hypoplasia. And the causative, the cause of Turner's hypoplasia being trauma. Okay, so trauma would be a past history wherein the trauma would be to the primary tooth bud, and the succedaneous permanent tooth which comes over will be discolored into a brownish discoloration. Usually the teeth that are involved is maxillary central incisor or the premolars. So usually you have a brownish discoloration of teeth, right? So the next question. Again, it was a big question, it was a lengthy question, but again you had very evident clues in those questions, okay? So this question was, a patient was operated for thyroidectomy, all his parameters were normal, but in the evening the patient had pain and swelling over the neck, correct? Later on, when examination was done, bouts of clots were found in the surgical site. So what could be the type of reaction that is shown? Okay, so the options were primary, reactionary, secondary, or malignancy, and all those were the options, right? So can you all come to the answer for this? It is very simple. If you get the basic of what is a primary hemorrhage, what is a reactionary hemorrhage, and what is a secondary hemorrhage, you will be able to answer such questions. Anybody here who will be able to answer the question? So basically, the answer for this question is a reactionary hemorrhage, okay? So again, what we need to know here is about the primary hemorrhage, reactionary hemorrhage, secondary hemorrhage, right? So what is the difference between them? So when we talk about the primary hemorrhage, any hemorrhage or any bleeding that is seen immediately after the surgery, right? That is your primary hemorrhage. Now what is a reactionary hemorrhage? Patient, after the surgery, the patient is discharged or patient goes back home. Nothing happens for some time. But in the evening, the patient comes with bleeding or pain. Correct? That is a case of reactionary hemorrhage, wherein the patient has or patient shows hemorrhage or reactions within 24 hours post the surgery. That is reactionary. Correct? And the third thing is secondary. What happens in secondary is, in secondary, the patient comes with the hemorrhage after 7 to 14 days post the surgery, right? Now what could be the reason for reactionary hemorrhage? Right, somebody has come up with the answer. The reactionary hemorrhage is the right answer. What could be the reason for a reactionary hemorrhage? So it could either be due to clot dislodgement or might be due to technical failures like slippage of sutures and all that, right? Even mobilization when it comes to those areas could cause reactionary hemorrhage, right? So that is about the third question. Moving on, another lengthy question but a common question that has been discussed in Dental Pulse, and you have been seeing such type of question previously. So the question again is, it gives you very evident keywords and clues. Can somebody come up with the answer to this? So there was this 32-year-old obese woman who had polyphagia, polydipsia and polyuria. He was under diabetic treatment for the last 3 months but irregularly. Okay, the fasting blood sugar level was 140 mg per dl and postprandial blood sugar level was 240. So what was the investigation that has to be carried out in such kind of patient? Again, very important for you all to know, when you do fasting blood sugar or the postprandial blood sugar, always the results can be influenced by the diet you take on the previous day. Correct? So whenever in such cases where you want to know the diabetic control or the glycemic control of such a patient, what you need to know is that you need to check the HbA1c, which is the glycosylated hemoglobin. Okay, so whenever question comes on measuring the diabetes control or glycemic index, whatever those questions are there, the answer to those questions would be HbA1c, which is glycosylated hemoglobin, right? Then you had, I think, more than one question on Ellis and Davey classification, right? So when we talk about HbA1c, one more thing that I wanted to tell you all, whenever there is increase in HbA1c, the patient is sure to have diabetes mellitus. But be aware that HbA1c is not a diagnostic tool for diabetes mellitus. When you have a lower HbA1c, that doesn't rule out that you do not have diabetes, right? Fine. Moving ahead, about Ellis and Davey classification, somebody who has already answered the exam would know you had a question on a non-vital tooth. So non-vital tooth comes on which class of Ellis and Davey classification? Right, so let's discuss. There is a small lag that's happening, so that's why I'm not waiting for the answer, but you can put out the answers in the chat box, right? So when we talk about Ellis and Davey classification, it talks about the fracture of the tooth, right? So Ellis class 1 is crown fracture involving only the enamel. Very good, very good. Class 4 is non-vital. Very good, right? So Ellis class 1 involves only the enamel portion of the crown. Ellis class 2 is again crown fracture, which involves enamel as well as some portions of dentin. Ellis class 3, like you see in the picture, it involves enamel, dentin and pulp. So all first three, 1, 2 and 3, those involves your crown, correct? Ellis class 4, the question that was asked, you can see here discolored tooth. What could it be? Ellis class 4 represents any non-vital tooth. Okay, with or without crown loss. The crown needn't be fractured or lost, but if it's a non-vital tooth, it comes under Ellis class 4, right? Ellis class 5, as you see here, stands for avulsion, avulsed tooth. Okay, Ellis class 6 is for root fracture, irrespective of the crown fracture or no, any root fracture comes under Ellis class 6. Okay. When it comes to Ellis class 7, it stands for luxation injuries. Okay, the crown and the root can be intact. Whenever there is luxation, it comes under Ellis class 7. Ellis class 8 involves cervical crown fracture. Okay, so this portion, if there is a fracture of the crown entirely, that could be Ellis class 8. And what is Ellis class 9? Tell me the answer. Moving ahead, very simple question. Gutta-percha. What is the amount of gutta-percha in gutta-percha? So this question looks very simple, but these are all those minute details that we do not stress upon while we prepare, right? So there are chances that you might have made a mistake in this question, but that's okay, right? So what is the percentage of gutta-percha in gutta-percha? So the percentage of gutta-percha is 20%. So let's just discuss what the constituents of gutta-percha is. So basically, we have 20% of gutta-percha as the matrix. What is the filler used in gutta-percha? It is zinc oxide. So around 65% is zinc oxide. Then we have 10% heavy metals which are used as radio opacifiers, and then 5% of waxes here and there. Right? So the answer for this question was 20%. Now there was this question on cross infection in hospitals. So how are these best prevented by? The options were fumigation, disinfection, hand washing. So all those options were given. So what could be the best possible method to prevent cross infection in hospitals? So the answer here is proper hand hygiene. Okay. So always note, proper hand hygiene is the best method to prevent cross infection in hospitals. Compared to all the other things, fumigation, antibiotic prophylaxis, everything else is important. But most important is proper hand hygiene to prevent cross infection. Right. Then there was this question on the sequence of polymerization. Again, direct pick, a basic question, be it in Pulse, your textbooks, anyway, you'll be able to see this answer to this question. You would have come across this so many times. So these are all those questions that you cannot go wrong in, right? So the sequence as shown here is initiation, propagation, termination and chain transfer. Now there was this question on modified periodontic triangle. So what is the extra factor that has been added in modified periodontic triangle? So we all know in the periodontic triangle, so the three factors that are present are the child or the child patient, the family of the child and the dental personnel, the dentist or the assistant, whoever is treating the patient. So right, so that is a basic periodontic triangle. What is that extra factor that is included in the modified periodontic triangle? So society is that factor that influences this periodontic triangle, and the modified periodontic triangle includes the society as well, right? That is about periodontic triangle. So all these questions that have been telling from the beginning right now, these are all very simple, right? There is no complication in these questions, correct? So whenever we do an analysis or whenever we ask the students, the only questions they tend to recollect are the ones that are very difficult, correct? Those are the ones they recollect, and the easy ones, it will be the last questions that the students recollect, right? But when I come to see after the recall, after we made the list of questions, I come to see there were a lot of easy questions as well, right? It was not that it was all bouncers and difficult ones. There were a lot of direct picks, correct? Like this question that you see here, a child with fever, cough, throat pain. Again, the most important keyword in this question, they have mentioned about a gray pseudomembrane that was easily scraped off. Direct answer, right? So whenever you know about a pseudomembrane, the answer here, there were options of diphtheria, scarlet fever, gonorrhea and candida, I guess, right? So whenever you see pseudomembrane, the answer is diphtheria, right? Pseudomembrane has a washed leather consistency. That is one thing that you need to know about, and it has a well-defined edge, right? Usually seen around the tonsil area. Okay, so that is about your pseudomembrane, which is that microorganism that causes diphtheria. Again, the name is given in the microorganism as well. It is Corynebacterium diphtheriae, right? So that was another direct question, but a lengthy question. One more direct pick, needn't explain much. Laminin and fibronectin are what? So we all would have come across in dental pulse. They are glycoproteins. Parathyroid develops from. Again, there is inferior parathyroid and superior parathyroid. So what we need to know is that again the brachial pouches, the pharyngeal pouches and the derivatives, they are very important. Okay, you need to be thorough with this. So these are questions I assume that you all would have made it right. So the inferior parathyroid develops from the third pharyngeal pouch and the superior parathyroid from the fourth pharyngeal pouch. But the question I think did not have the third pharyngeal pouch as a option. So the answer here would be the fourth brachial pouch. Then there was a question on leaf-fold fracture, on asking which bone is involved in a leaf-fold fracture. For that, what you need to know is about a leaf-fold fracture. So as you see in a leaf-fold 1 fracture, sorry, the question was leaf-fold 1. So as you see here in a leaf-fold 1 fracture, which area is exactly fractured? So there is a separation of palate from the maxilla, correct? So this is why they call it as a floating fracture. Correct? So the answer to this question was maxilla. Maxilla is the bone that was involved in Leaford 1 fracture. Again, commonly used terminology or numbering system, 3-3 refers to, very easy, right? 3-3 is a two-digit numbering system which is by FDI, Federation Dentaire Internationally, right? So what is 3-3 refers to which tooth? Again, you know how the FDI representation is. I needn't explain it to you all. So the 3-3 refers to the right answer is lower left canine, right? Moving ahead, another simple one, dentin that is freshly laid over pulp. The answer to it is predentin. So predentin is a non-mineralized layer that is laid directly over the pulp. So what happens is predentin later on changes or transforms into dentin as mineralization continues and more predentin layer is deposited near the pulp. Okay, so that is about your predentin. Another basic question that we have heard of and we have been reading previously is about the Case triad. So what exactly does Case triad assess? Okay, so that was the question. The answer to it is Carey's activity test. So Case triad assesses the Carey's activity, and what are the factors that comes under Case triad are questions that have been previously asked. So that also you need to know. Dental plaque or the substrate, tooth, the microflora, the diet, all that are factors that comes under Case triad. One last question we'll discuss. There was an image based question showing this. So what was the answer for this? That will come in the next segments or the coming segments, wherein we'll discuss just the image based questions we had for NEET MDS 2023. So we'll have a segment on that as well. This one is just a trailer of that, the image based question, which is very simple, that was given for you all in your exam this time. That was your fordiasis granule, and I assume most of you all would have got it right. Right? So yeah, with that, this was just the basic simple questions, right? The difficult ones and its explanations are loading. So we have decided by the end of this recall video, we'll share a document with you all where you can access all the previous year question, the questions that have come for NEET MDS 2023 in a sequence, right? So we'll be sharing the document with you all soon. Stay tuned for more.